Welcome. Hi, everybody. Welcome. It is Adele, your friendly nurse, Lyme educator, and coach, here as always to marry my background in nursing with the world of holistic healing that I love so much to give you hope and solutions along your own Lyme and tick-borne illness healing journey. And if you haven't met me, that's the summary of me. Also, don't forget, if you're catching this on YouTube, make sure you like, subscribe, even hit the bell so you don't miss any notifications about my live videos. Today, I want to chat about a seemingly maybe controversial-ish topic, but when you actually think about the nuts and bolts of it, it makes a lot of sense. You'll have to forgive my lighting. As you can see, I'm banking on window lighting right now, and it's coming and going a little. So sorry if I fade a bit. But I want to talk to you about the symptoms of Lyme disease or tick-borne illnesses and when they matter and why. In the world of healthcare, sometimes a broad picture is needed to make a diagnosis and a treatment plan, right? But Lyme disease is not a typical illness, and it is not a very easily testable illness. And this is a key point in this whole topic. Why this matters is because if there is not reliable or consistently reliable testing for Lyme disease, and there isn't, what do we do with that when we have people that have tick bites that are also symptomatic and suffering with symptoms? So, in case you don't know this fact already, some experts suggest that Lyme disease blood work testing is at best, maybe at best, 60% reliable. And this is from reputable labs that specialize in Lyme disease testing, not just your everyday labs. Places like IGeneX Labs, MDL, DNA Connections, Vibrant, maybe even. But some of the top names are actually IGeneX and MDL are some of the top guys in lab work for Lyme. And even those cannot guarantee 100% accuracy because Lyme, especially of all tick-borne illnesses, but other tick-borne illnesses as well. So kind of when I'm saying Lyme, I'm kind of meaning the whole gamut of co-infections you can actually get too from a tick bite or a vector infected with these diseases. The bottom line is a lot of them hide out in the body and they evade detection in the bloodstream, especially as time goes on, especially as you become in a more chronic picture of these infections. So at the end of the day, lab work is not our one and only reliable source of Lyme disease diagnostic information. So on one hand, with Lyme symptoms, you're looking at the patient. Do they have symptoms? But here's the caveat and why I say the when and the why matter. Initially, not all patients that have a Lyme-infected tick bite are going to necessarily be symptomatic. In the Lyme literate world, though, that is not a reason to delay treatment. Waiting for symptoms upon an initial tick bite is actually more detrimental to long-term outcomes than treating upfront and not delaying. Partly because if you are to run lab work for Lyme on someone that has been bitten, the ideal time to do that is actually not until 4 to 6 weeks after the bite, at which time, if they're already infected, that infection has had a long time to establish itself in the body and create problems, whether or not the patient feels like they're symptomatic. Additionally, symptoms vary widely. Not everyone's getting a bullseye rash. That's old news now. That is a small percentage. Some say less than 50% of Lyme disease patients actually ever get a rash or a bullseye rash. There's also other types of rashes that you can get with Lyme, other types of symptoms. Yes, there are some more common symptoms than others, but it's not always guaranteed that you'll get the fever, the joint pain, the bullseye rash, and a proper diagnosis. So Because symptoms can vary, and if you want more information on that, please comment below because I actually have other video content I've done educating about symptoms of Lyme. I'm not going to get into all the variations of that and co-infection symptoms today, but I'm happy to share more resources with you in that light as well if you need more. So because not everyone's going to get symptoms right away or at all or for a while necessarily, some people don't get symptoms for months or longer. Treating right away in the world of Lyme literate providers is their best practice to avoid potential complications. So, on one hand, symptoms don't matter initially necessarily, right? Because they're not a guarantee, or they could be mislabeled or misdiagnosed even. But with a known tick bite or suspected tick-borne illness, treatment right away has some beneficial outcomes. However, when symptoms do matter is whenever they pop up. Symptoms trump diagnostic testing in the world of Lyme literate providers. And I do believe that it should. Based on my own experience and the experience of others I know that have suffered because their symptoms weren't taken into consideration when the lab values didn't support what the doctors that weren't trained in Lyme wanted to see. All I mean by that is this is a case where diagnosis can be hard, but ongoing suffering with continued chronic illness problems or continued sickness problems in the face of suspected or known tick bite or Lyme disease exposure should be taken seriously as a symptomatic disease that needs treatment. Whether or not lab testing, blood work, or cerebrospinal fluid supports a positive result. A patient's experience matters in healthcare. And in this case, we know already, like I said in the beginning, that we cannot bank on lab testing to be reliable. So the answer to this question is symptoms may not matter immediately up front in terms of treating properly immediately, but they certainly do matter if they ever do pop up. When they pop up, they matter. And they matter because they're indicative of a positive Lyme diagnosis. Many Lyme literate providers would say that alone, positive symptoms alone, is a positive diagnosis, regardless of what the lab results say at all. Just some thoughts to think on today, my friends. If you have had experience with tick bites or Lyme disease at all, what has your experience been with symptom belief versus lab results? Have you run into issues with healthcare providers? Have you found Lyme literate providers to view things differently in your world? In mine, they have, but we all have our own experiences, and I want to show you how they do matter. And because they matter, I invite you to comment your own experience and share and dialogue and learn. Just be respectful, right? That's all I ask. All right, my friends, here's to your healing journey, whatever that may look like, because it is uniquely yours and you are uniquely you. I'm here cheering you on every step of the way.